Contraceptive Patch, a presentation by Lisa Curley. Let's look at the basics. The contraceptive patch is a thin beige plastic patch that sticks to skin and is used to prevent pregnancy. It is commonly called the Ortho Evra, which is its brand name. How it works is it releases hormones. Hormones are chemicals made in our body that control how different parts of our bodies work. The hormones in the contraceptive patch are estrogen and progestin. Hormones work by keeping eggs from leaving the ovaries. Pregnancy cannot happen if there is no eggs to join with the sperm. It also makes cervical mucus thicker, keeping sperm from getting to eggs. The contraceptive patch was introduced to the U.S. market in early 2002 under the name Ortho Evra. The price usually ranges from $15 to $80 per month. Now, to start the patch, a woman must first speak with her healthcare provider, usually within the first 5 days after the start of her period, so that she is protected against pregnancy right away. If she starts the patch later than 5 days after the start of her period, protection will begin after 7 days. Now, when starting the patch after pregnancy, it is usually safe to wait 3 weeks after giving birth vaginally before you start using the patch. How to use the patch. Consider the first day you apply the patch as the patch change day. So that day will be the day you change, apply, or remove your contraceptive patch. Each one is worn for 1 week, consecutively for 3 weeks, and then the 4th week is patched. That is your menstruation week. It is worn on either the abdomen, buttocks, upper body, or upper arm, specifically not the breast. Make sure to check the patch every day to make sure it is properly sticking. When you remove the patch after 1 week, make sure to throw away in the trash and do not flush it. The patch still contains hormones, so this disposal method will reduce the chance the hormones will get into the soil or water supply. There are many pros when using the contraceptive patch. Some of the benefits include many women have more regular, lighter, and shorter periods. The ability to become pregnant returns quickly when the use of the patch is stopped. It is said to improve sex because it helps women feel more spontaneous, and it eliminates the need to remember taking a daily pill. Some of the health benefits similar to the pill include protection against acne, bad menstrual cramps, bone thinning, serious infection in the ovaries, tubes, and uterus, breast growth that are not cancerous, and many more. Along with the pros, there are many disadvantages to using the contraceptive patch. These include breast tenderness and enlargement, headaches, nausea, spotting or breakthrough bleeding, abdominal cramps and bloating, vaginal discharge, may expose women to a level of hormone 60% higher than most oral contraceptives. Long-lasting effects include may change a woman's sexual desire, may have a reaction or irritation where she puts the patch on her skin, and after she stops using the patch, it takes 1 to 2 months for the period to return to the cycle before she's using it. Serious risks include blood clots, stroke, or heart attack. There's a 9% failure rate and a 0% perfect use failure rate. Contraceptive patch does not protect against STIs. So, the use of a latex or female condom to reduce risk of infection is recommended. It is pretty common for women to forget to change or apply their patch on time, as well as for the patch to fall off. However, there are some general instructions for protecting yourself from that unplanned pregnancy. If you forget to apply the patch during the first week, apply a new patch as you remember. That will become your new patch change day, which is the day of the week you normally change your patch. Wear the late patch for 1 week. Also, use a backup method like a condom or a female condom, diaphragm, or sponge for the next 7 days after you apply that new patch. If you forget to apply your patch during the week 2 or 3 of the process, change it as soon as you remember, and change to your next patch on your regular patch change day. If the patch becomes loose or falls off for less than 1 day, reapply the patch. If the patch will not stick, apply a new patch. Change the patch on your regular patch change day. If it has been more than 1 day or you are unsure how long it became loose, apply a new patch. This day of the week will become your new patch change day.